Hello, friends of Powerhouse Bakery and Divas and Dudes of San Antonio. I'm so glad to have you today. My name is Suzanne Parker, and I'm the founder and CEO of Powerhouse Bakery. And what we do here is love to teach people about healthy. One of my typical routines is to have people come in looking for a bakery, since our name is Powerhouse Bakery. And oftentimes people that are looking for a bakery want to have a little something special, especially when they're looking for something like gluten-free, which is oftentimes what brings people here to Powerhouse Bakery. When I started Powerhouse, our goal was to have super healthy that tastes amazing. What's really started to happen is we become a teaching environment, helping to teach our customers what it means to choose healthy, whether it's from a bakery or from any restaurant or even the grocery store. And if you've seen any of my other videos, I talk a lot about finding your ideal, finding your best foods, trying to understand what lifestyle habits will be something that you can easily repeat, something that's going to lead you to a better path of wellness, and even ways to incorporate your family and things that they'll enjoy with you, because of course we want to have our family and our friends dine with us as part of the social and even emotional experience of what we do around the table. So today what I want to talk to you about is something that is also related to a lifestyle issue. It's not a very fun topic: metabolic syndrome. So when I have patients or even customers that come in and are looking for healthy, they're trying to understand how to avoid some of the big ticket items that we've learned are not going to give us a healthy lifestyle. What I want to talk about today is the metabolic syndrome, which is a group of conditions that really increases our risk factor for some chronic diseases. If you know of anybody that has heart disease or obesity, or even just high blood pressure or elevated cholesterol, they probably also have this cluster of other diseases or conditions that increase their risk of some really serious ailments. And so metabolic syndrome, what I want to do is talk with you a little bit about what this condition is. So what are the signs and the symptoms? I also want to talk with you about the risk factors. So when you have these conditions, what happens, or what are the elevated risks that you are predisposed to? Because when we understand the conditions and the risk factors, it helps us really understand what transitions do we want to take as soon as we can to minimize the progression of this chronic cluster of diseases. So let's get started. The metabolic syndrome is really a combination of some signs and symptoms that you can see and some that you can't see. You might know the one that you can see is obesity. And it's not just a typical obesity, but it's abdominal obesity. So when you have obesity that is around the waistline, this type of fat adiposity is that puts you at higher risk. And why do we have a genetic tendency to have more weight put around the core? It does have to do with ethnicity. It does have to do with lifestyle, and I'll go into some of those predisposing factors in a moment. But as we think about what can we see in the metabolic syndrome, obesity is, of course, the one that we see as most obvious. The ones that we can't see are happening inside of our bodies. So what we can't see is elevated blood pressure, as well as elevated blood fats. So let's go through each of these and try to understand them a little bit more on the scientific approach as well as the lifestyle approach. So let's look at this. What happens with obesity that is primarily around the waistline? What we see happen is the body develops an insulin resistance. And again, it might have to do with genetics. We know that ethnicity and age increase your chances of getting metabolic syndrome and getting the obesity around the core. Even as people age and their hormone levels change, it increases the likelihood that fat deposition will happen right around the waistline. What is happening inside the body is we have an insulin resistance that's going on. So when the body makes insulin, the job of that insulin is to open up the doors of the muscle cells so that the blood levels of sugars can go in and work for energy in those muscle cells. Now, in somebody that has insulin resistance, this doesn't happen very well. Instead, the pancreas keeps making insulin, but the sugar level keeps going higher and higher in the blood. So the blood is not being cleared of that sugar going into the muscles. Instead, it's staying high in the blood. And of course, that is not good. That increases our risk for diabetes. When we see the risk of diabetes go up, we know that that's something that is, of course, dangerous. It affects the periphery. It affects the blood's ability to carry insulin. When the blood gets sticky, and that happens when the blood levels of sugars go up, it gets sticky, and that means that the hemoglobin cannot carry the blood oxygen very well. So that leads to the diabetes and, of course, the periphery starting to break down and develop necrosis, or dying of those small arteries and veins, and feeding the tissues is no longer possible when the blood sugar is so high that the glycogen, like the glycosylated hemoglobin, is now affected. So a lot of science around that, but what I really want us to see as a takeaway is insulin resistance happens sometimes because of genetics, sometimes because of inactivity. So if we have low activity level and we have very little muscle cells, the muscle cells are not doing a good job pulling the blood sugar out of the bloodstream. So we know that activity will turn that the other way, and if we've got exercise happening, then insulin resistance will be less likely, and of course now we get to go back in the other direction and not have the risk of obesity. So when the fat cells enlarge and the muscle cells shrink, it definitely contributes to the body's inability to pull that sugar out of the blood. Make sense? The other piece of the puzzle is that when we have insulin resistance, we can't really tell that anything is going on. We don't normally feel bad, and that's why it's one of those that we can't see. So blood pressure, blood fats, and also blood sugar are those components of the metabolic syndrome that we can't always tell. That's why it's always a good idea to go to your doctor and have your blood pressure checked and have your blood sugar checked on occasion. But the body still does give us a warning sign. When the waistline starts going up, that's when we want to start asking our physician about maybe checking some of these elements that we can't see. And sometimes we have a measurement. The waist-hip ratio is something that helps us identify, is our waistline expanding in a dangerous level? Normally, we know. If we look in the mirror and we can tell that our waistline is expanding, we know that that's a risk, and it's time to look at diet intervention, which is why sometimes I have clients come to Powerhouse Bakery looking for weight loss. But we know for sure that when the waistline starts to increase, there's something that we can do about it. We know that checking our blood pressure and checking our blood fats are something that we can do that's going to improve our situation. Blood pressure, if it is greater than 130 over 90, we know that blood pressure is a risk factor of getting the metabolic syndrome. It's a cascade of events that makes the whole system of our metabolism not work as well. And having an elevated blood pressure, again, is going to compromise the function of our organs, like the pancreas, and so then the insulin resistance will be affected, as well as the muscles. If the muscles cannot get oxygen as well as that good blood flow, it's going to prevent the optimum working of those muscles and using of that insulin and, of course, the sugars. So blood pressure, when it's too high, prevents those muscles from getting the oxygen that it needs. Same thing with blood fats. We know that triglycerides and overall cholesterol is an issue when we're looking at metabolic syndrome. Triglycerides are a direct correlation with our diet. When we eat foods that are high in sugars or high in total fats, our triglycerides will go up on the short term. More of a long-term review of how we're eating will be represented by the total cholesterol. When our total cholesterol number goes up, it's from two things. One, when we eat more total fats, and second, when our body has to make more cholesterol in order to package and transport the fats that we've eaten. So again, it all boils down to good choices of eating, and I'll talk with you about that in a moment. But I want us to really see how the symptoms that we can't see have a very profound effect on the metabolic syndrome, and it all has to do with our choices. Not only our activity level, but also our food choices. So thinking about the food choices and the activity definitely has an impact on our waistline as well as our muscles and their functioning. The other part I want to tell you a little bit about is when we're looking at blood fats, we know that if the triglycerides are chronically high, like maybe above 150, that's a warning sign. If our total cholesterol is greater than 200 milligrams per deciliter, that's also a warning sign. Here's another one that sometimes we don't remember, and that is when our good fats, those HDLs, start to go down. Those HDLs are a really key factor in all of this metabolism. These are the good fats, and how we see those, if we could look into our blood, the HDLs are very dense. They have a large protein center and very little of the outer fat carrying. And that's because they're ready to pull fats from the bloodstream and carry them outside of the body. So they go through the digestive tract and can exit from the body. So we like HDLs because they carry excess waste products of small fat molecules from the blood out via the liver and the bile. We can get HDLs to go up in our body if in fact we increase our activity. So there again, we've got this great opportunity to affect our metabolism, decrease our risk of the metabolic syndrome, decrease our waistline, decrease our blood pressure, and improve our blood fats in two ways, not only by our exercise but our food choices. If we decrease the total amount of fat we consume, our body will not have to make as much cholesterol, and when we exercise, the HDLs, the good fats, those small little dense fat molecules will increase. So that gives us such a win-win, and again, so much of our control is in this whole scheme. So we want our HDLs to be greater than 45. We want our total cholesterol to be less than 200. And of course, our triglycerides, we want those to stay low also. So how do we do that? Let's talk a little bit about the food choices that fall into this whole scheme of the metabolic syndrome. When we think of sugars, those are small sugar molecules that come from fruits and refined carbohydrates, and that's often why carbohydrates have gotten a bad name, because we know that when we consume simple carbohydrates, two things happen. It turns on our need for insulin, and it turns on the triglyceride count that starts to happen in our blood. Because our body will process the sugars, we need to have insulin to pull those sugars into the muscle. The secondary fact is our liver starts to make little fat molecules from the digestive materials, which are the sugars. And so we see an increase in triglycerides, and we see an increase in our need for insulin by taking in lots of sugars. And we know that sugars are easy to find. If we could take out 5 items from our diet that would be sugar rich, what do you think they would be? Number 1, sugary beverages. So if you are already adding sugar to your coffee or your tea, or you're drinking sodas or even fruit juice, that would be an easy way to reduce the total amount of sugar we're taking into our body, and it would help us to reduce our risk of metabolic syndrome. It would decrease the amount of sugars that goes into our bloodstream, thus increasing the need for insulin, and of course minimizing the risk of getting those fat cells to enlarge. The other thing is we want to decrease the amount of total fats we take in. So liquid fats like vegetable oils are a real important target when we're trying to improve our overall diet. There's a lot of confusion around what types of fats should we increase and decrease. So let's suffice to say that in general, even the USDA has a great recommendation, and that says that 30% of our total calories should come from fat. And of that 30%, a third of it should be from saturated sources, a third should be from mono unsaturated, and the other third from polyunsaturated. So how do we find all those fats? In general, we want to do nuts and seeds. You've heard me talk about that probably before, and that's because nuts and seeds are really perfectly aligned. The way nature made seeds and nuts is that there's a great ratio of some saturated, some polyunsaturated, and some monounsaturated fats, just like our body needs for optimum digestion. And when we make sure that that optimal level of monounsaturates is rich in our diet, that helps the HDLs to be at their ideal level. So increasing HDLs by exercise as well as by picking the right fats in our diet. And that's sometimes confusing because I know that we oftentimes say to decrease total fat, and that might be where you need to be based on your eating style. But we also know that some fats are really good for us because it not only gives us the essential fatty acids that we need for our diet, but it also helps to improve the blood ratio of those good fats versus the bad fats. Now, when we talk about cholesterol, I've mentioned it a little bit, but I want to go in a little bit deeper. We know that our body uses this cholesterol molecule to transport the fats all throughout our body. So if we eat foods that have cholesterol in them, our body just makes a little bit less. So foods that are low in total fat but have a source of cholesterol probably isn't as risky as foods that are high in total overall fat. Here's an example. The egg. The egg has gone in and out of popularity because it's kind of known as being something that our food that's high in cholesterol. But if we look at the total makeup of the fats of an egg, just like with shrimp, those two foods are low in total fat based on its calories, and it's got a good amount of those monounsaturates as well as the polyunsaturates that truly do help the ratio of those cholesterols. So I hope this has helped as you think through the elements that we can't see in our body. Blood pressure, we can't always feel. So exercise as well as stress management are great ways to control our blood pressure. The other way that we can control our blood pressure is by weight. So we always go back to looking at this as a primary risk factor of the metabolic syndrome. And remember, it's a cluster of conditions that increases our risk for some of the most critical lifestyle diseases. Those lifestyle diseases are coronary artery disease or coronary vascular disease and chronic hypertension, which does sadly often lead to stroke. And of course, diabetes. So if we have elevated weight that lives primarily around the waistline, we know that something's going on in the body that is contributing to insulin resistance. That insulin resistance is probably due to two things: our muscles not able to bring in the sugars from the blood, and that we have too many fat cells that are inactive and they cannot use the blood sugar. So too many fat cells, not enough muscle cells, aka too little activity, and then of course too poor of food choices that truly contributes to that insulin resistance. Cardiovascular disease does have some genetic risk factors. So you probably know somebody in your friend and family network that doesn't have the metabolic syndrome. They are normal body weight, they don't have diabetes, and yet they still died of or had a chronic issue with heart disease. And of course, there's some things that we can't change. And so we do want to focus on the things that we can change and know that sometimes genetics has the last card to play, and we can't control all of those factors. But the good news is that the folks that come into Powerhouse Bakery, I teach them with food and with exercise, we really can make a difference in understanding how the metabolic syndrome overall impacts us as a culture. We know that hypertension can also be impacted by genetics alone. But we know that if our weight is maintained at an ideal body weight, our risk of having hypertension is absolutely decreased. So let's talk a little bit about what ideal body weight really is. If you've ever gone to the doctor, or insurance companies will give you a chart that'll say, based on your height, you should weigh this amount. And again, that's very vague. Ideal body weight is actually based on charts and graphs, which of course we know that there's a lot of variation in people, so you can still be healthy even if you're not at your ideal body weight. That doesn't always have to happen. What I like to do is teach people about a desirable body weight. So even if you are 5'5", and the charts say at 5'5", if you're a woman, you should weigh 125 pounds. And you might be saying, gosh, I'm 5'5" and I've never weighed 125 pounds. I've always weighed 135 and I feel great. That's what we call desirable body weight. Of course, the charts and graphs in the doctor's offices do say that there's a range that we are okay with in ideal body weight. But we also want to look at, where do you carry your weight? So if you are actually at your desirable body weight of, say, 10 pounds or maybe even 20 pounds over what the charts say you should be, if that's the case, but your waistline is okay, then you're probably at much less risk for the metabolic syndrome. You have less risk factor for cardiovascular disease and hypertension and diabetes. So where you carry your weight is really important in this whole paradigm of how our metabolism gives us an increased risk. So let's work it the other way. Say you are at 145 pounds and all of your weight is around your core. What do we do about it? Let's talk a little bit about how we manage that. If you have a high risk, your weight is carried around your core. This is what we call an apple versus a pear shape. I know, crazy that we would use fruit to describe the shape of people. But if you have a pear versus apple shape, not a very good pear, but you get the idea, your weight is below your hips. So for ladies, thighs and glutes. So weight is on your legs and maybe even your arms. When you have a pear shape, you are at less risk because your heart is not as at risk. It's not as hard for your heart. It's not encased in as much extra fat. If you are an apple shape, this is where you have the most risk. So whether you're using your ideal body weight or your desirable body weight, your shape is going to be the most important. You want the fat to be as far away from the heart as you can. And truly, by exercising, you have a very quick response to the fat in your core. So even by increasing your walking, any kind of activity, you don't have to do 45 minutes a day on a bike or run if you hate to run. Any kind of activity is going to help decrease the fat around your heart. So we want to decrease the fat around the heart by exercise and of course diet. And so exercise, any type of exercise, is going to help to decrease the fat right around your core. So if you have a pear shape, you're doing pretty good. If you have an apple shape plus high body weight, this is what I want us to do. I want to increase activity by 30 minutes on 5 days of the week. And all you have to do is walk. So walking is good. The second thing I want us to do, if you have an apple shape and you're above your body weight that the charts give you, or even your desirable, so remember, ideal body weight or desirable body weight, and you have the fat that's really distributed around your heart, the other thing we want us to do is decrease total fats. And what would that look like? That means you get 1 teaspoon of fat, or we'll call it butter, in the morning, and you get 2 teaspoons of fat, so you could do something like almonds or walnuts or even a little olive oil, 2 teaspoons of fat at lunch, and another 2 teaspoons of fat at dinner. So I always like to give some real application. If you know that your waist circumference is larger than your hips, this is where we want to do some change to reduce our risk of heart disease, of stroke, and of course of diabetes. And if you don't have high blood pressure right now and you don't have elevated fats, that's awesome, and we want to keep you there. If you do, then this is a really important step to take that's going to help you minimize your risk of that metabolic syndrome. So no more than 2.5 tablespoons of fat in the day. Easy to do. Of course, we want to decrease the amount of sugars. Like I mentioned, don't add sugar to any beverage that you consume. No coffee, tea, or sugary sodas. Super important. And I promise you, you're going to have a much better approach to your wellness plan. And if you have questions about how to do this, coming into Powerhouse Bakery is great, but I also have lots of videos on YouTube. I hope you can visit those and like us on Facebook as well as YouTube, so we know that we're giving you valuable information. And don't forget to send us questions if I can help you at all with learning your journey of finding your best foods and your ideal list of proteins, carbohydrates, and fats to find your ideal eating style. So if you want more information, I'd love to hear from you. Hope this has helped, and I hope you have a great rest of your day. Bye-bye.